Hi, I'm Dr. Carrie Jose of CJ Physical Therapy and Pilates, and today I want to explain to you the natural history of low back pain. So let's say this line represents your baseline of how your back feels kind of pre any kind of back pain episode. All right, it feels good, 100% pain free, um, pretty mobile. But then you have your first back pain episode. What happens is it'll naturally get better, but it won't always get down to your original baseline. And when you're there, you'll feel pretty good. You'll feel like you're 100%, but as you can see, you're not quite 100%. And then what happens is, anywhere from a few months to a year, even a few years later, you'll get your next back pain episode. And what happens is this time you'll see that it'll take a little bit longer and you won't get as close to your baseline. You still might feel good here, maybe not quite as good, but you might blame it on old age or things like that. But you're not back to where your strongest baseline is. And the natural history of low back pain works like this. You'll get episode after episode after episode until suddenly your baseline, your new baseline is far away from your old one. And this is where you start to live with things like chronic back pain. Okay. And we don't want you there. So now let's look at it a different way. So now this is your injury threshold. Okay. This line represents that. So this is kind of just below the surface of where you'll have pain. So as you can see, back pain episode can easily happen the closer you are to that injury threshold, all right? We want your baseline of your back to be way below that, okay? So you might feel fine there, okay? But it doesn't take much for you to hurt yourself, okay? You're one sneeze, one wrong move away from episode after episode, okay? And a lot of us live right here. We don't want you living there, okay? Where we want you is far below that injury threshold. We want your back feeling strong, strong core, full and free mobility gets you way below that injury threshold, and you're far less likely to have back pain. You can tolerate what I call more turbulence, okay? Your back is more resilient. You can sneeze, you can bend, you can lift things, and you're much less likely to have a back pain episode. That is where we want you living, okay? We don't want you living just underneath that threshold, even though you might be, quote, pain-free there. So if you want some help lowering that pain threshold and getting your back baseline much lower than where it is now, let us know. We're here to help. You can talk to one of my specialists anytime for free to see if you're a good fit for what we do and if we can help you. Thanks for watching.